Good morning, everyone. Myself, Dr. Mohammed Asif, consultant and interventional cardiologist from Olive Hospital, Hyderabad, Mehdipatnam. Today, I will be discussing few important topic to make you aware about the cardiovascular diseases. We all know that a cardiovascular disease is very highly prevalent and it is seen nearly 16% of the population of Indian population, and it is so rampant. We hear on and off that one or two patients or even young patients dying of heart attack very frequently. So my duty is to make you aware regarding the cardiovascular disease, how prevalent it is and what we can do to prevent the cardiovascular disease. So it includes like cardiovascular disease includes like heart diseases. It can be a ischemic heart disease, or it can be a hypertensive heart disease, or it can be a rheumatic heart disease, or it can be a one which is with the congenital heart diseases. So usually congenital heart disease are encountered during newborns or in children, and rheumatic heart disease will be encountered between the age group of 5 to 20 years, or sometimes they can present even later also. And hypertensive heart disease is prevalent in elderly population, and coronary artery disease again it is prevalent from 30 to above 30 years in males and above 50 years in females, and it's very common in elderly patients. So let me make you aware how prevalent this disease is. So the number of deaths from heart disease is increased from 2 million in 2000 to 9 million at present scenario. So it is rising at alarming rate and the deaths are very high. Second, the world's biggest killer, that is ischemic heart disease, it's responsible for 16% of worldwide all deaths. Means to say, if every 5 deaths, it can be a cancer, it can be a stroke, or it can be a traffic accident or any other accidents, or even you can take a COVID deaths. If 5 deaths are occurring, 1 death is due to a heart disease. So what are the signs and symptoms they present with the heart disease usually? So usually they complain of chest pain, which is typically retrosternal, radiating to the left arm, associated with sweating, palpitations, or sometimes they can present with syncope or with a severe sudden onset breathlessness. We should suspect a cardiac disease, especially in males above 30 years and in females above 50 years. Then apart from that, the blood fluctuations in the blood pressure, a lower blood pressure or the higher blood pressure. Then extreme tiredness, extreme sweating, extreme diaphoresis, palpitations. So these are the various presentations of this heart disease, how you can diagnose. If you feel any of these symptoms, it is advisable to visit a nearby cardiologist immediately and get attention. So either you get a ECG done immediately, so you get to know if there is any problem is there or not, and it will be treated accordingly. Now in this pandemic of COVID-19, the cardiovascular disease and COVID-19, what do we know so far? We know that the COVID-19, the mortality is very high. Even in the Indian government has recommended the vaccine for those with the age of above 60 years. So the reason for that is the patients with above 60 years, they have multiple comorbidities and they have the associated heart disease, associated hypertension, associated diabetes. So those patients with diabetes, hypertension or associated any other problem, they are at the higher risk of mortality, the higher risk of death, higher risk of complications due to COVID-19. Apart from that, how do we prevent a COVID-19, this coronary heart disease? So the most important thing to prevent heart disease is a simple thing. Remember that one thing is adopt a lifestyle changes. That is, you should have a practice of daily walking at least 30 minutes per day, 3 to 4 days per week. Eating healthy fruits, vegetables will also reduce the chance of heart attack. Third, if you are diabetic, control your blood sugars. Fourth, if you are hypertensive, control your blood pressure adequately. Fifth, if you have the habit of smoking, then to stop smoking completely. So these are the various important lifestyle changes you have to adopt. So the overall, the cardiovascular disease, it is one of the top killer disease worldwide, and we should be aware of that. The prevention is better than the cure. Thank you very much.